Well, hello there, folks. Welcome to Advisory. Welcome back to school. It's Wednesday. Feels a little weird to go to school, then not go to school, then come back to school in 1 week. But we're here, and we are being so brave. Today in Advisory, we are going to recap a few things about Red Ribbon Week. We're going to do the same thing tomorrow. Last week had all sorts of testing and a pep rally, and so we weren't really able to get into a couple of the things that I wanted to. So today I want to consider two questions. Number one, why do you think people do drugs? And then number two, what are some things that we can do to prevent either ourselves or others from doing drugs? And our WT White journalism students went out and asked you those two questions. First, why do you think people do drugs?
Why do you think people do drugs?
I think a lot of people use drugs as like a coping mechanism for like things that they go through at home and they don't know how to talk about it. So they a lot of times turn to drugs or they fall into peer pressure, like your friends smoke or do drugs and then you want to do it too because you want to fit in with them.
Why do people do drugs?
Yes.
Um, to get like a sense of euphoria, because they're, going through something, or maybe they just ended up going down that rabbit hole. Like they thought, they could control it, but they ended up
Okay.
going deeper into it.
Why do you think people do drugs?
To solve pain and resolve pain, but that's not true. I think people should stop smoking, stop doing drugs, stay sober. You know what I mean? But I think they do drugs for to get over depression, pain, dealing with something.
Their influence. That is the biggest thing. They have friends who influence them. And so that's how a lot of them end up using drugs.
Why do you think people do drugs? Because they're depressed or sad or want to feel numb. I don't know.
I guess because they don't feel like they have anything else to turn to when they're dealing with hard times. So they think that doing drugs is a way to escape it in a way. I don't know.
Okay.
That's what I think, because I don't do drugs. So.
People probably do drugs out of boredom. Like at this school, they be bored, and also just to get away from their troubles and stuff like that.
Okay, who am I here with?
Coach Lewis, athletic coordinator, head football coach.
Okay. Why do you think people do drugs?
I just think sometimes people are looking for outlets, and they're looking to fill voids in their life sometimes. Sometimes drugs may feel like it'll get them away from problems and stuff like that.
To escape reality.
Why do you think people do drugs?
They do it just to I guess feel better about themselves or to get over problems.
Why do you think people do drugs?
I don't know. I mean, I think I'm always concerned when someone's using here at school because I really feel like that's an outcry for help. But I think sometimes it's because they have pain or they're upset about something and they want an escape from it. And instead of, doing something positive like talking to a friend or talking to a counselor, they end up choosing just the escape that is drugs.
Some very good answers there. And it seems like we're all on the same page that the reason that people do it is maybe largely because they don't feel as though they have anything else to turn to. But I also wanted to talk to an expert to make sure that your answers lined up with what the science says and what psychologists say in regards to drug use. I'm going to show you a brief portion of an interview that I did a couple of years ago with a counselor that used to be here at WT White named Miss Hill. Some of you may remember Miss Hill. She was only here for a short time, and I wish that we still had her on campus. She's working elsewhere in the district right now. But while she was here, she specifically focused on talking to people about drug use. And she had a few things to say on this subject as well. What are some of the dangers of if I feel bad and I'm using drugs or I'm using a vape or something like that as the kind of the only coping skill? What is the danger of that? What are the risks there?
Sure. So if we are currently only using substances as a coping skill, what that's going to look like for people who are under the age of 25, because our brain is still also developing, what our brain's doing is taking the substances that is going in and kind of treating it as something that we always need to feel good. So when we don't use and we feel like at our normal level of good, our homeostasis, we feel lower than we were before. So we kind of always need more and more.
All right, thank you to Miss Hill for that expertise. So, if those are some of the reasons that people do drugs, what are the things that we can do to prevent drugs or prevent ourselves from doing drugs? Once again, I asked our journalism students to ask you that same question.
How do you think people can avoid drugs?
I think people can avoid drugs by like choosing like who they're friends with. Like if you hang with the wrong crowd, then you end up doing what they're doing. So I think choosing the people you hang with is a good thing.
It's important to avoid drugs because um, it's going to be hard to getting out of it. And a lot of people like say that they can control it and stuff, but then it ends up like controlling their lives and ruining their relationships and reputation.
Like as a whole, like everybody.
Yeah.
Honestly, I feel like we can't. Like drugs are already like everybody already knows what a drug is and stuff like that. And back in the day, I think it used to be normal for them to do drugs, for the kids to smoke weed or something like that. I think it used to be normal. Correct me if I'm wrong, but like I don't think there's nothing that we can actually do to prevent drugs besides standing up when you don't want to. Yeah, say you don't want to.
I think that most of the kids that are substance free here, and most adults I know that are substance free, it's because they have other things going on, you know? So they're playing sports, or they're really involved in their academics, or they're working, or they're, you know, participating in fine arts or doing something, and they have something else that they're really interested in.
Okay. What are ways you can prevent doing drugs or avoid drugs?
Going to a gym, distract yourself with something else instead of.
Maybe doing extracurriculars, I feel. Just like, it's kind of like helps to keep you active and keep in shape. So like you don't have to do drugs.
Surround yourself with people that don't do them.
You can prevent drugs by just always going to class, like not hanging out with the wrong people and like stuff like that.
Okay, what are ways you think people can prevent or avoid doing drugs?
I think like people not being around people who do them and doing other things so you don't think about doing drugs. Probably distracting yourself. I don't know.
Having a proper resources set up for when you have hard times. A lot of people do drugs due to depression and stuff like that. But if you can, find activities, stuff like that, get involved, exercise, find things that keep you busy.
Hang around the right crowd. Some ways you could prevent them. You could prevent them by not. Oh, wait! I didn't know this was the question. Don't get involved with them. If your friends are doing it, just don't join them. It's bad for you.
Preventing it, like, if you see somebody doing drugs, like, I would encourage them not to do it, and they'll go down a bad pathway. So probably stop and talk them out of it.
One of the ways is education and your parents. You want to make sure that your parents is open with you and you are open with your parents. If you have a problem, that you can talk to them, and that is something that doesn't happen a lot. And also be selective with the people who you hang around, who you play with, your friends. Make sure that they are clean and they are people who could influence you to do other things.
Talking to teachers and talking to like people you know and safe for you.
All right, and once again, a lot of very similar answers. Who you have around you can be a big factor as to whether or not you start doing drugs. And you also heard some examples of other coping skills like going to the gym or participating in extracurriculars, being involved in your community, whether that's school or your neighborhood or your job or whatever it is, can help prevent you from falling into a cycle of drug abuse. And once again, I asked Ms. Hill for her expertise on things that we can do, coping skills that we can use instead of drugs. And here's what she had to say.
But what a coping skill is something that we do to manage feelings or emotions that are overwhelming. So if we're super stressed out and we choose to go to the bathroom and smoke to kind of calm down, an alternative coping skill could be, if you were in gym, for instance, like doing 10 push-ups, because what that's going to do is it's going to take that energy and it's going to kind of displace the emotion. Another coping skill could be journaling, writing down how you're feeling. And what that does is take the emotions out of here and puts them elsewhere and helps us see a bigger picture. There's a lot of different coping skills that we can discuss. Not every coping skill is going to work for everyone. So it is very individualized.
All right, we're all aligned with these answers. Strong community, safe people, and distractions, things to do instead of using drugs, are all huge things to have in place in order to prevent you from falling into a drug abuse cycle. After hearing all of your classmates and Miss Hill talk about these things, I now want you to discuss these things. Number one, in addition to what was said in the video, what are some other reasons that you think people resort to abusing drugs? We are thinking with empathy towards people that use drugs of why they might do these things and get to the root cause of their behavior. Number two, why is it dangerous to have drugs be your only way to cope with difficult situations? Ms. Hill said that drugs are a coping mechanism, technically, but they are not a very healthy one. They are not a sustainable one. So why is it dangerous to have drugs be your only coping mechanism? And then finally, as a class, I want you to spend the rest of the time making a list of possible coping skills or coping methods to use when you feel strong emotions. I want you to have a big list on the whiteboard of things that you can do or things that you do to deal with difficult emotions or strong emotions instead of using drugs. And it can be something big like going to the gym all the time or working out, or it can be something small like taking some time out to read or maybe draw something or some sort of other creative outlet. Anything you can think of that is a better coping mechanism than using drugs goes on the whiteboard. But that is all from me. Enjoy that discussion. Be good to yourself and others, and I'll see you tomorrow.